Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. Do glucose level affects cognitive performance in people with type 1 diabetes? A new study led by researchers at McLean Hospital and Washington State University have demonstrated that naturally occurring glucose fluctuations impact cognitive function in people with type 1 diabetes. The study published in the journal NPJ Digital Medicine revealed that cognition was slower in movements when glucose was atypical, that is, considerably higher or lower than someone's usual glucose level. However, some people were more susceptible to the cognitive effects of large glucose fluctuation than others. Type 1 diabetes is an autoimmune disease characterized by glucose variability. Previous laboratory studies have shown that very low and very high glucose level impair cognitive function. However, technological limitations made it difficult to study the impact of naturally occurring glucose fluctuations on cognition outside of laboratory, preventing researchers from obtaining repeated high-frequency measurements within the same individual over time. High-frequency measurements are necessary to understand whether glucose fluctuations impact cognition similarly for everyone. In the study, researchers collected high-frequency glucose and cognitive data from 200 individuals with type 1 diabetes using digital glucose sensors and smartphone-based tests. Glucose levels were measured every 5 minutes and cognitive assessments were conducted 3 times daily for 15 days. This data collection allowed researchers to analyze the cognitive effect of natural glucose fluctuations. Utilizing machine learning, they investigated individual differences in the impact of glucose on cognition.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The results showed that cognitive function was impaired when glucose was considerably higher or lower than usual. The researchers also found that people differed from each other in terms of how much glucose fluctuation impacted their cognitive speed, and some people, including older adults and adults with certain health conditions, were much more impacted by glucose fluctuation than others. Our results demonstrate that people can differ a lot from one another in how their brains are impacted by glucose. We found that minimizing glucose fluctuations in daily life is important for optimizing processing speed, and this is especially true for people who are older or have other diabetes-related health conditions, said Laura Germine, PhD, co-senior author of the paper and director of McLean's Laboratory for Brain and Cognitive Health Technology. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.